Hello, dear students. Welcome back to our news channel. Students, today we are diving into a really important topic that affects all of us, challenges in India, and specifically, we are talking about the non communicable diseases or NCDs and how they are becoming a big problem for urban areas and what can we do about it. So, this episode is for students, young minds like you who are the future of our cities. So, let's talk about why this is important and how you can play a part in creating healthier cities for everyone. Let's start with our cities. Yes, cities where dreams come true for many, but they are also places of struggle for others. Have you ever thought about the people who make our cities run smoothly? Bus drivers, delivery workers, sanitation workers, and even construction laborers. They are the backbone of our urban lives, yet they often live and work in very tough conditions. Most of these workers don't have access to healthcare or even insurance. Imagine working long hours and breathing polluted air and eating unhealthy food because that's all you can afford. This is something reality. This is actually reality for many people in our cities. And did you know that nearly half of the people in urban India live in slums? That's about 49%. So, according to a report by UN Habitat and the World Bank, uh, around 49% of urban people live in slum. And living in slums means facing overcrowding, poor sanitation, and limited access to healthcare. तो ऐसी रिपोर्ट के से हमें ये पता चलता है कि कितने सारे लोग स्लम में रह रहे हैं और स्लम में एक्चुअल में जो कंडीशन है यस बहुत ज़्यादा खराब है. All right. Now let's talk about non-communicable diseases. Yes, students, non-communicable diseases are basically those diseases that don't spread from person to person, like heart disease हो गया, diabetes हो गया, blood pressure हो गया, and even some cancers. Most of the times, they are often linked to our lifestyle. है ना, लाइफस्टाइल से रिलेटेड है एंड दैट इज द रीजन दे आर ऑल्सो नोन एज लाइफस्टाइल डिजीजेस. लाइक लाइफस्टाइल कैसे, जैसे व्हाट वी ईट, हाउ एक्टिव वी आर एंड द एनवायरमेंट वी लिव इन. एंड हियर्स द प्रॉब्लम, NCDs are silent. You might not feel you might not feel sick until it is too late. जैसे कि someone could have high blood pressure for years without even knowing it, without even realizing it, and then one day they could have a heart attack. तो NCDs क्या है? Silent है. They are silent and it require regular screening. रेगुलर स्क्रीनिंग के लिए बहुत ज़रूरी है. और जब अगर हम इंडिया की बात करते हैं स्टूडेंट्स, द नंबर ऑफ पीपल विद डायबिटीज एंड हाइपरटेंशन इज इंक्रीजिंग rapidly. And this is a big concern because managing these diseases is expensive and difficult, especially for low income families. Now, the reason behind this increase, the question is, why are NCDs rising in cities? आखिरकार cities में ये NCD नॉन कम्युनिकेबल डिजीजेस इतनी ज़्यादा क्यों बढ़ रही हैं? राइट स्टूडेंट्स, द थिंग इज, अगर हम सिटीज में लाइफस्टाइल की बात करते हैं, पुअर डाइट, लैक ऑफ एक्सरसाइज, पोल्यूशन एंड स्ट्रेस, all these factors are responsible for increasing NCDs. And many urban workers eat junk food because it's cheap and quick. They don't have time to exercise and they breathe polluted air every day. आपने कभी देखा होगा कि आप रोड से जा रहे हो और जहाँ पे कंस्ट्रक्शन का काम चल रहा है, ऑलरेडी सिटीज़ में जो एयर है उसकी पोल्यूशन की क्वालिटी कैसी है? अगर हम दिल्ली की बात करते हैं वहाँ पे तो और ज़्यादा खराब है. और उस पर से कंस्ट्रक्शन जो वर्कर है, या फिर जो डेली वेज अर्नर्स हैं, राइट, अगर वो बाहर जाके काम नहीं करेंगे तो उनका घर कैसे चलेगा? एंड दे डोंट हैव टाइम फॉर एक्सरसाइज। घर सारा टाइम लाइवलीहुड सस्टेन करने के लिए ही निकल जाता है, राइट? सो दिस आर्टिकल इज सेइंग दैट अर्बन पुअर कम्युनिटीज, जो गरीब लोग हैं, अर्बन पुअर कम्युनिटीज, दे फेस व्हाट्स कॉल्ड अ ट्रिपल हेल्थ बर्डन। ट्रिपल, ट्रिपल हेल्थ बर्डन। दिस मीन्स व्हाट दिस मीन्स, ट्रिपल हेल्थ बर्डन का मतलब क्या है? फर्स्ट, hazardous work environment, meaning the jobs that are physically demanding and unsafe। तो ट्रिपल हेल्थ बर्डन में अगर हम बात करते हैं तो पहला जो फैक्टर है इज विच इज रिस्पॉन्सिबल इज hazardous work environment। Second, limited access to healthcare, limited access, क्योंकि हॉस्पिटल्स नहीं होंगे आसपास, और जो है आसपास वो काफी ज्यादा एक्सपेंसिव है। दिस इज इन रेफरेंस टू जो गरीब लोग हैं, पुअर कम्युनिटीज है इन अर्बन एरियाज। थर्ड इज फाइनेंशियल स्ट्रगल। यस, फाइनेंशियल स्ट्रगल्स ड्यूरिंग हेल्थ क्राइसिस। तो एक तो हैजार्डस वर्क एनवायरनमेंट है, जो कि जैसे जॉब जो रिक्वायर करती है कि काफ़ी ज़्यादा फिजिकली डिमांड करती है और अनसेफ हो। लिमिटेड एक्सेस टू हेल्थ केयर। एंड थर्डली, financial struggles during health crisis. Many families, they end up in debt when someone gets sick. These are all constitutes, you can say, triple health burden. For example, let's think about a bus driver who works 12-hour shifts. He is stressed, sitting all day and exposed to pollution. If he develops diabetes, he might not even know until it's too late. And we know that treating diabetes is costly, and his family might have to borrow money or skip meals to pay for it, right? So what is missing? India has policies for preventing and managing NCDs, but the thing is that these policies are not working well in cities. Healthcare system in urban areas are, you can say, overburdened and even broken. Did you know that public healthcare in India is designed to help everyone, but it is actually accessible to only about 40% of the population? This is especially true for poor people in cities. Now, what we need is better solutions. We need primary healthcare, that is the basic healthcare. We need primary healthcare to reach everyone, especially the urban poor. And here's some good news, which this article also talks about. Yes, uh, technology. Technology can help, right? Kaise? With smartphones and apps, we can monitor health problems like high blood pressure and diabetes in real time. Imagine an app that reminds you to check your sugar levels or connect you to a nearby health worker. So technology can even help government टू कलेक्ट डेटा कि कहाँ कहाँ पर हॉस्पिटल्स की ज़्यादा ज़रूरत है, डॉक्टर्स की ज़्यादा ज़रूरत है। तो इट्स लाइक हैविंग अ हेल्थ मैप ऑफ द सिटी, राइट? नाउ we know that our cities are growing fast, and with that growth comes challenges, especially in healthcare. Non-communicable diseases are silent threat, but they are preventable. And by spreading awareness, improving the healthcare access and using technology, we can create healthier cities for everyone. Let's remember, a healthy city means a healthy future. All right. So, thank you for listening to today's podcast. Stay safe, stay healthy, and don't forget to take care of yourself and those around you. Bye bye.